Europe is facing another viral outbreak. This time, it's measles. The World Health Organization says cases are the highest in 25 years. One child in the UK has tragically died from this disease, so why are infection rates soaring? Hello and welcome to Roundtable. I'm Enda Brady. Now, measles immunisation rates in Europe have failed to recover from pre-pandemic levels, with anti-vaccine sentiment contributing to the fall. There's been a sharp increase in measles cases across Europe, and the United States is also experiencing a 33-year high. So, how can European governments help prevent the spread of this highly contagious disease, which particularly affects young children?
A rash, high fever and cough. These are symptoms of measles, a highly infectious disease previously eradicated in many European countries is now back. So far this year, over 6,000 measles cases have been reported across the EU, according to the European Centre for Disease Prevention and Control. Romania has the most cases, and other countries with rising infection rates include France, the Netherlands and Austria. In England, more than 500 cases have been confirmed since January, and a child has died from the disease in its northern city, Liverpool, where only 73% of children under 5 have been vaccinated. So why aren't more children being vaccinated?
The problem is that more recently, for a number of reasons, one, because of a Lancet paper that's now retracted by Andrew Wakefield is retracted for being sort of a fraudulent link between the MMR vaccine and autism. We've also had a bit of disruption with the COVID vaccine, as well as some sort of conspiracy theories and miseducation between the link between autism and measles, which has meant that parents have been sort of more afraid to use the vaccine than they would have otherwise.
According to the World Health Organization, over half of Europe failed to reach the recommended 95% vaccination coverage in 2024. So will European governments get more children vaccinated against measles this year and stop the spread of this disease amongst its populations?
Well, let's meet our guests. In Geneva, in Switzerland, we have Dr. Margaret Harris. She's a public health doctor and former World Health Organization global spokesperson. In Kyiv, in Ukraine, we have Oksana Pyzik. She's associate professor at the University College London School of Pharmacy. And I'm delighted to say, here with me in the studio, we have Annette Kellow. She's a parenting journalist and broadcaster. You're all very welcome to this roundtable. Margaret, to you first of all, in this day and age, in 2025, no child anywhere should be dying of measles.
That's absolutely correct. In fact, where vaccination has been effectively used, 60 million children between the period 20 to 23, 60 million children have survived because they were vaccinated. So it's averted 60 million deaths. So those are kids who now are productive adults as a result of being vaccinated. So it's a terrible tragedy to lose a child simply because they were not vaccinated.
Oksana, to you, just tell us, how worried are you about the rise in the number of measles infections, not just in Europe, we're seeing it also in the United States?
Yeah, and if we look at the UK specifically, none of the under 5 routine childhood immunization targets, which is at 95%, meaning you need 95% of children to be vaccinated in order to have that herd immunity protection. None of those targets have been met, and it's been the lowest that we have seen in decades. Even in my neighborhood, I have noticed that GPs have been hanging up signs on the door, on the outside, saying rates of measles have gone up. If your child has a rash, come see the doctor. So we're at a point now where I have, in my career, never seen that these public notices are going out throughout the community to help raise awareness. And a lot of this distrust means that more children are getting sick and are not getting that routine care.
And Oksana, you say that figure of 95% for herd immunity. I notice across England, for example, the figure is 84% have been vaccinated. And in one city, Liverpool, where that awful tragedy of a fatality of a child occurred the week before last, the figure is as low as 73%. I mean, this is deeply concerning.
It's deeply concerning. And we also have, even within London, 60% in the borough of Hackney. So it's well below that 95% target. Now, the UK government has responded by trying to get health assistants to come and do home visits, to vaccinate children at home. And that is one way to reach these underserved populations. But that alone in itself won't help change minds. It does help reduce sometimes when there are other reasons why people cannot physically get to the GP or a pharmacy to get their vaccine. And it's a good pilot program, which other countries can also emulate. But we have to do a lot more in terms of improving health literacy of parents to ensure that they understand that they could potentially be putting their children's life at risk and lose a life completely unnecessarily.
Thanks, Oksana. Annette, to you, anti-vaxxers have a lot to answer for here, haven't they?
Absolutely, and we are seeing a very big difference between before COVID and after COVID. Before COVID, it was a 94% uptake of the MMR, and now it's at 83.9%. So we're seeing a 10% difference pretty much. And I think part of that is sort of vaccine fatigue, perhaps not having enough knowledge, not enough health literacy with it. But also there is sometimes too much information is not a good thing. There's a lot of mum influencers, a lot of online forums where people discuss vaccines. And yes, it's good to be able to have things at our fingertips, but not when it's the wrong information. And as we've seen with the Liverpool case, it's a huge tragedy. We also had the situation in Wales, Swansea, 2013, quite a while ago, but they had a huge outbreak there, and sadly one person died. So we're seeing that come around again. There's 529 cases this year alone in the UK, but last year there was over 2,000. So it's not good.
These influencers, I mean, they're causing problems.
Definitely, they're causing huge problems in the sense that parents should have the knowledge from a doctor or a health professional. And I think perhaps if they brought that more into schools, that may even help people. I know when you go to the doctor, they sometimes check that people have had them, but I think it needs to be more of a campaign. After the situation in Swansea, they actually brought out a catch-up campaign, and they really promoted it to parents. And I think doing something similar would also work. Another reason in Liverpool that people cited for not getting the vaccine was that it was not flexible with their working and also transport costs, surprisingly. So perhaps they could even bring in something to help where they could have the vaccine out of hours or even help with the transport costs.
Margaret, to you, you have worked at the highest level in public health for decades. Give me your honest assessment of these vaccine skeptics and the damage they are doing.
I think, honestly, they're well-meaning, and that has to be understood, that many of the people who are most sort of passionate, even if in our view they're passionately wrong, are people who do care. And so first of all, it's really important to hear what they're saying. But I think the critical thing for parents is you've got this perfectly healthy, beautiful child, newborn baby. And you're terrified. And so if somebody says to you, look, if you stick that thing, you let those doctors stick that thing in all these bad things are going to happen to your child, you can understand that fear. But as my colleagues have just said, the other panelists, it's critical that the medical system, the health system, make itself very available to explain fully, to listen to parents' concerns, and in a sense also to explain how serious these diseases are. There's a real problem in Europe of what we call vaccine complacency. People have not seen the consequences of these diseases, and they're awful. So I've seen them because I've worked as a pediatrician, but parents haven't seen what happens if your beautiful child gets one of these infectious diseases and is the one that gets the severe form.
Oksana, to you, so what are their concerns about being vaccinated against measles?
Again, I think most people understand that of what a vaccine is, which means that you are able to train the immune system to respond to that particular pathogen. But again, with the rise of mom influencers, there are concerns about one of the things I often hear from people who have concerns about vaccines are what other products are inside this. Things like concerns about formaldehyde, etc. And unfortunately, there's still the legacy of Andrew Wakefield, despite the disapproval of his claims of a link to autism. The thing now is that with algorithms and social media, once this misinformation takes hold, it amplifies so much faster than scientific experts trying to explain that is in fact not true. There is no link. And this has been through millions of trials proven to protect children's health and not cause any of these adverse effects that get a lot of popularity and attention in the media. And the other point is that it's actually very expensive to respond to measles outbreak. If you go take a preventative measure, you're saving like 13-fold by just ensuring that people have the right information and that they are treated in advance, preventing it, rather than the cost of trying to contain an outbreak later on. That becomes much more problematic. We also have the tragic cases in Samoa where measles vaccines were rejected and hundreds of children died as a result of a misinformation campaign. The problem with misinformation is that it sounds like it could be true, and it can be very difficult to disprove for those that have already bad experiences in the healthcare system. And so we really do have to ensure that all healthcare professionals, that's everyone from nurses, doctors, pharmacists, healthcare assistants, are able to listen to the concerns that people have, because they can often be legitimate, and not to dismiss them. And so as the education and training role, we have to do a lot more to earn that trust of our patients. And that is something that unfortunately takes time. And in this instance, when we're so far behind the vaccination deadlines, time is of the essence.
Thanks, Oksana. Margaret, I just want your opinion of this Wakefield character. Struck off as a doctor, that widely discredited research of his, that's 2 decades old, and yet his name keeps coming up. How damaging was that?
So this just shows exactly how just one small piece of misinformation can create a firestorm. And unfortunately, he indeed was a doctor, and this paper was published in The Lancet. Now, it's been described as the worst and most damaging medical hoax in history, and it's definitely been very, very, very clearly disproven and shown that his reasons for doing it were not anything to do with science. But indeed, that paper gets repeated, and the fact that it was published in a reputable journal is enough for many people to keep repeating the claims, which indeed again, because you see much more autism, or there are many more numbers of autism recorded or reported than there were 30 years ago, people say, well, then you see that something must be causing it. But in fact, the reason we are reporting much more autism is we're looking for more of it. We know what autism is, and we look for autism at all levels, whereas whether it be mild autism, when you can function perfectly normally, or severe autism. So that's why we're seeing much greater numbers.
Thank you, Margaret. Annette, to you, it's almost as if the medical world needs to fight back with a public health campaign, or have their own kind of influencers speaking scientific fact.
Absolutely. I think people need to find trustworthy sources. And I think when it becomes like a fire of people not believing something, it goes on and other people start believing it. But I think also there's a sense of it won't happen to me. And, you know, it seems like if you don't see it with your own eyes, a lot of people believe it's just very mild. And you do hear of people saying, oh, they had the mumps, or when they were younger and they were absolutely fine, or the measles and they were absolutely fine. But the fact is that 1 in 5 people with measles do get hospitalized, and also 1 in 15 have serious consequences such as pneumonia, brain inflammation. It's not so much with the mumps. That's like 1 in 20,000 may have a serious issue. And obviously rubella is very low but very dangerous for pregnant women. And that's pretty much been eliminated. I think there's been 2 cases in 2018, but we haven't seen any more. But the measles is the big one, and I think this is what people are really talking about right now. I think there's also this very slight thing in the back of people talk often about when it was separated, and now it is not. So from my research, some people on forums will say, well, it used to be separate. Is that better? Is that not? Actually, it's neither here nor there. It's just they brought it together so that people could find it easier, quicker to do the doses rather than playing catch up with all 3. So I do think health advisors, doctors need to be involved with this. But I also think if you look at the NHS, they often outsource private appointments elsewhere. And perhaps there could be something where people could have private appointments which are, I don't know, paid for by the NHS or helped by the NHS so that it can reach more people so they can do it in the evening or some other way.
Thanks, Annette. Oksana, to you, measles is a really nasty disease. It causes blindness in some cases, organ damage, brain inflammation. Just spell out to parents out there who are perhaps sitting on the fence about the vaccine. Just spell out to parents the damage measles can do to a child.
Yeah, so I think you've highlighted the fact that it can cause multi-organ failure, and in a small child, this is children under the age of 5 are the most vulnerable. So this is why they need a vaccine. They need that boost to their immune system to protect them from a highly infectious disease that spreads very easily. And again, once we get below that critical 95% threshold, it's not just your own child you need to consider, it's the fact that we need community protection. So I would encourage parents to consider, even if they've missed it in the regular routine, it's not too late to catch up, that they can go to their doctor and get this vaccine so that their child doesn't have to needlessly suffer and die as a result of measles complications. Now, this is something at a community level. We have seen some success when sometimes religious leaders and other cultural groups give this medical information in religious centers. When we talk about acceleration of infectious disease, it can happen very quickly. And once that stage of infection gets so severe, there's very little that doctors can do to save the patient's life. And so again, children under 5 are incredibly vulnerable. It's not too late to get a vaccine. If they missed it at that under 5 window, they should still go get a routine immunization, and that we should encourage the community at schools and other ways to ensure that parents don't feel judged about their decision, but supported. And I think excellent points made by my other colleagues in terms of out of hours flexibility, like in the UK, having health visitors actually come into their homes. And I know that outside UCL during COVID, we even had these mobile vans of people driving around, going to people and where they are to get these vaccines out. So we need to be really creative, and we need to communicate to the message about all the risks that children in particular face from measles, and easily preventable with the MMR vaccine.
Thanks, Oksana. Margaret, to you, can I ask how you feel about very well-known politicians like Robert F. Kennedy Jr.? He has spoken out recently in the United States against the whooping cough vaccine. How damaging is it when you get people with no medical qualifications or background weighing in and getting a lot of airtime on this?
It's really actually heartbreaking to see, because people in those positions should be using their position to promote life and health, especially of our most vulnerable, our small children. So to see people who've got that influence, who've got and we mentioned the Samoa outbreak, that was a result again of that level of influence being taken seriously in Samoa. So wherever you see this kind of promotion, and we've seen it over and over again, particularly with politicians, I'm afraid, in many areas of health, wherever that happens, people do follow whatever they say blindly, and they do cause deaths. And for me, to cause the deaths of our most innocent, our most vulnerable, the ones we need to protect most, our children under 5, is really devastating.
Thank you, Margaret. Annette, to you, if we go back a few decades before the internet, before social media, people who wouldn't get their child vaccinated and were anti-vax before it was even a phrase or a thing, these were basically people we laughed at, cranks.
Yes, I think there was less information back then. And perhaps, I mean, I wasn't around then, but perhaps doctors didn't push it so much. I'm not sure how things worked with when they went into doctors and things like that. But now I feel we have that education and we should be looking at it from a very different approach. What's very surprising, out of all the G7 countries, we, the UK, are the lowest uptake of the vaccine currently. Japan, America, Germany, they are all 90% currently, but we are way below that. So one has to ask, well, we have the free NHS, we have the access, so why aren't people doing it? And I don't know whether it's time constraints, the feeding of misinformation, but I think as well, as parents, it's really good to speak with people in the school. I mean, we had one person at my school who had measles, and so I think you have to learn from that and just apply it to your own life. I mean, these are our little babies and they are our future.
And just tell me, do you think COVID has changed everything? That there was so much noise around the vaccine and people, not wanting it and anti-vaxxers. Do you think that in the UK has changed the mentality?
I think it's changed the mentality, definitely, as we've got a 10% difference currently. But with the COVID situation, I feel like it's not just the COVID vaccine that made people start looking at medical things differently. It was things like, how long are we going to be in a lockdown? How long are we going to have to wear masks for? When are we going to be able to go to our favourite country on holiday? And those little tiny things sort of fractured how people think of things. And then suddenly they're suspicious. So I think it's something we really have to work on.
Oksana, just come in on the whole COVID issue and the impact of that situation. Talk to me about how it has influenced people's thinking about vaccines.
Certainly, I think that although countries had different levels of response, some of the most severe restrictions, of course, in Asia and China, and other countries having a much more open and relaxed approach. But I think what tends to happen is that at an individual level, people will compare their own experience and those around them and treat that sometimes as a universal truth. So if they did not have in their immediate family or through their networks someone who became severely ill, who got long COVID, who tragically passed away, etc., then there is a tendency to minimize the overall global scale and the fact that we had an actual drop in life expectancy during those short years as a result of, again, the elderly population being most vulnerable and seeing the highest rates of mortality. So I think there is, again, this cognitive bias towards reducing the extent of the severity of COVID and then the necessity of the vaccine themselves, which is then has made communicating the benefits of vaccines for a whole suite of other infectious diseases much more challenging. So that's a problem of heuristic logic, where we just look at what's happening us immediately in our little circles rather than on a global scale, and the fact that actually we're still catching up as a result of the pandemic. We still have health systems under strain, waiting lists not complete, people living with long COVID, but there is I'd say a desire to kind of forget about that era altogether, and a distrust now of a medical expertise. And I think throughout that, characters like Joe Rogan, other popular podcasters that had people on their programs and did not challenge the claims that were made, whether that was reproductive health or mental health or otherwise. And so I think there's some multi-layered complex reasons why we overall have shifted away from medical expertise, and it means that there is a lot more communication that is going to have to go into at the government level to reach everyone, because that narrative that about the global scale of tragedy hasn't really stuck. And even the COVID inquiry in the UK, the government got off pretty easy despite some of the big errors that were made.
Margaret, to you, just one final point. What would you say to any political leaders around the world who are watching and wondering what they can be doing to drive up vaccination rates in their countries?
Please speak to your populations and recognize that your babies, your children are your future. And the best way to protect your future, the health of your future, is to get those vaccinations in your children under 5. It will also save you a lot of money in the health system. And it will improve the economics and productivity of your population. So please, vaccination is your friend, not your foe.
Thanks, Annette, and to Margaret and Oksana as well. Thank you all. Remember, you can see more discussion and debate on our YouTube channel. Just search for Roundtable TRT World. But for now, from me, Enda Brady, and all the team here, goodbye and thank you for watching.